Welcome back. It is another time to talk self-medication and its implication in a challenging economy. You know, one of the things that a lot of people will tell you these days is, well, I need to do this because that's the only option that I have. My guest, Dr. Joseph Agogo, a medical doctor, is supposed to join me on the program today, but he just had an emergency. And you know how it works for doctors. He is right in the theater. He's just getting into the theater now for an emergency session. And for that reason, he couldn't join me. He was just called from home. You know how it is. That's how it works for medical doctors. Those in the profession already know what I'm talking about. But then, let's just talk a little bit, all right, from the human angle of it as it is. When we talk about self-medication, is you treating yourself, giving yourself treatment without the knowledge of the doctor, without you carrying out a medical check to really know what's wrong. That is you taking drugs based on assumption, based on calculation. Okay, it happened to Mr. A and this was exactly what they did, so I should go get that same drug. Or probably you don't have enough and you just get to the backyard and what do I do? This leaf, they said it does this. This leaf, they say it does that. I read it on the internet. Someone said it. It's not even proven. You just jump at it, and before you know, you are boiling something to take without even know the quantity. And you don't know whether what you are doing is even drug abuse already, taking excess, because there is no measurement, there is no prescription. No one is telling you this is the level you need to take. You just fetch in a cup, maybe, well, this is the much I can take. Some persons even go to do this when they are thirsty. They just go fetch it and just drink because they feel, that's going to work, without any experts. And these things are dangerous. We've had situations in the past. I could remember a time when I was covering the health as the health sector as my beat back then, when I was a presenter in one organization, not here, a media organization, not global television, and we had cases where people would just go about self-medication. If I say this on it, will even amaze you that people even give themselves injection without the doctor knowing. They just do that because they feel they don't have the money to go to the hospital. Some persons will tell you, well, we can't even conduct a test. This is the advice from every professional, okay? And anyone who is human and know how to take good care of themselves will understand what I'm talking about. The issue of you carrying out a medical check on yourself first and foremost before you even know what is wrong with you. In the first instance, you fell ill. Okay, maybe let's take for instance, you are having a headache, your head is aching, and you're running temperature, and probably you're stooling. Then you just say, okay, this is what I'm going to do. I'll ask Mr. A when he had this issue, what really happened. Whereas the body temperature, the level of the body temperature of Mr. A, when the person had that challenge, is different from your body temperature. Your level of stooling is different from that other person. The head that is aching is different from that of the other person. And what even resulted to the stooling is different from your own case, but you've not checked, you've not even been to the hospital to know what the challenge is, what the problem is. You just go ahead to do self-medication. This is dangerous. And as a matter of fact, let me just inform us that self-medication can be dangerous and lead to several complications and poor health. This is you trying to handle a particular challenge. Then it gets into complications. We've heard of cases where people run to the hospital and the doctor will say, who has been treating you? Who treated you before now? What's happening? What kind of treatment are you giving to yourself? Then now it is a complication. One thing leading to the other, and at the end of the day, you end up spending more than you would have even spent in the first instance if you had gone to the laboratory to get yourself checked. A lot of people take that for granted, but let me tell you, whatever health challenge you're having, it's better when you're being treated by a practitioner. I know what you're saying right now. I know, I can feel you. I know. Some persons are simply saying, well, you know what the economy of this country is saying. Even to get tested, you know what it's going to cost me. After being tested, then I'll be given the result. I'll go to the hospital. Then I'll see a doctor. I will be charged for consultation. Or probably, let's say for instance, it's even the doctor that has referred you to the laboratory to conduct this test after a check. Some doctors will not even give prescriptions. They will not tell you anything. They will not treat you. That's the word. They will not treat you until you have been tested. Though some private hospitals today, I'm not trying to condemn anyone, but some private hospitals today, because some of these hospitals are outside there just to make money. They may not care, but a professional doctor, the first thing they will tell you is you need to carry out a test. A test needs to be conducted on you to know exactly what the problem is. If you get to any hospital and especially some of these mushroom hospitals, I'm not trying to talk down any hospital, and that's why I'm not calling names. This is the reason you go to some hospitals and there are patients everywhere. The place is flooded. There is no space. Someone told me one time that the mother was having an emergency. They took her to the hospital and there was no place to even, no bed to even admit her because everywhere is filled up. But you get to some hospitals, you don't even see people at all. You don't see patients. Why? Because the first treatments you gave to that other patient didn't go down well. And that story has circulated. Maybe you just give that treatment based on assumption. And this is the same thing we are telling people not to do, because self-medication have implications irrespective of the economic hardship, irrespective of the dwindling nature of the economy. We know there is no money. A lot of people can't even afford drugs. We heard that doctors were crying out, pharmacists were crying out that they don't even have drugs on the shelf, not to talk about selling it, because most of these drugs are imported. Then you begin to look at how much is $1 to a naira. And this exchange rate that has affected the economy has also affected the drugs that are being brought into this country. And these are some of the things that are forcing people into self-medication, even though we said self-medication is not the best. Why? Because it is dangerous and it may lead to further complications. Maybe it's something that you would have treated for as low as 1,000 naira, you end up spending 5,000 naira because already there is a complication. This same doctor that I was supposed to have on my program today, we've had a program sometimes back, okay, not on Global Morning. We've had a program and there was something he said that I will never forget. While we're treating this same topic of self-medication, no, we're treating a particular topic. I think it was during COVID-19. We're talking about prevention, how it can be prevented and all of that. And we got to a point that we need to talk about how people treat themselves and how people relate with other people who have these issues, especially diseases that are communicable. There are ways that you are supposed to relate with people who are already down with some kind of diseases. All right. Why I'm saying this is because when we're talking about self-medication, sometimes the people who are sick, the people who are having these challenges may not even have the strength, all right, to do this self-medication, but somebody else is the one carrying out this self-medication on them, who are not doctors, who are not professionals, they are not even pharmacists, they are not nurses, but because they feel they have the knowledge, because they feel, well, this is what I told this person and it worked for the other person, and the same people are going ahead to treat these people. At some point, these people who are sick, who have these challenges, may not even be strong enough to carry out this medication, but you, who is an acclaimed professional in your own right, who is carrying out this self-medication on the people, is doing more harm to these people than good. So what you should have done, I'm not displacing the place of first aid. First aid is different. When we talk about first aid, it's different from self-medication. First aid is that first treatment. It may not even be treatment. Maybe, for instance, someone sustained an injury and maybe you have a cotton wool, then you clean it up, then you have a bandage, then you just wrap it around the person and you rush the person to the nearest facility available. But sometimes the facilities may not even be there. You get to the facility and you discover that these facilities are just buildings standing without anyone inside. I was privy to work with a non-governmental organization, and we specialized in malaria, educate people on malaria and all of that. And of course, the healthcare workers, their role, what they are supposed to do when people are down with malaria, what people are supposed to do not to have malaria and all of that. And it will amaze you that in some communities, you will go and you will see just a building, okay, a building, a health center, and there is no doctor there. You just have a healthcare worker, someone who is right there trying his best, even though the person is not a trained professional, but that the person just have some little training. The person is managing a facility which is not supposed to be. In some local government, you see that this health facility, which is supposed to be the number one social amenity that the people need, you go to some local governments, they have just one health facility, and people will have to travel from far and near to come there. But the question is, the drugs there, are they expired or not? The drugs there, will it be able to go around? What is the government doing about this? Because we need to look at the both sides of the coin. If you are blaming the people, if you are advising the people, not blaming them, but advising the people that it is not good to do self-medication, then you should also be able to do the balance. The health facilities should be close by so that the people can run to. Because when we talk about health facilities, okay, and maybe general hospitals, federal medical centers, they are more affordable. And that's the reason when you go to these hospitals, general hospitals, you go to federal medical center, you go to maybe health facilities, government health facilities in communities, you see people rushing in. But then, what are the House of Rep members doing with the allocations that is meant for these health facilities, or whoever that is concerned? The commissioner of health in that state, what is the person doing to make sure people are not encouraged to carry out self-medication, which will have implications, dangerous implications that will lead to complications? These are some of the things we should look at. These are some of the areas we should also consider. But as a matter of fact, we have a major role to play as individuals, because your health is very important. Even if you don't have anyone telling you these things, you should know that that woman carrying some substances, I don't know what they are, some liquids, as the case may be, in plastic bottles, moving from one location to the other, with maybe probably animal skin, the one they call pomo, because I don't know, but then it has become a business. It has become a business. But who gave the prescription? Are they really experts in what they do, or they give you based on how severe? If they will ask you, how severe is it? Some will not even ask you. Some people will go and they will tell you, give me 1 cup, give me 2 cups. These things are not measured. You don't even know the quantity that you're supposed to take, because NAFDAC is not even aware of it. So we need to be careful. We need to be careful so that we don't have complications, so that our liver, our body system is very sensitive. I am saying all of this based on my association with medical practitioners, all right, and as a researcher and as someone who interfaces between the people and even the doctors. But the bottom line is this. One, you have a role to play. The federal government also have a role to play. But then, you are the owner of the life. You can't say because there is no money, then you won't take care of yourself. There are so many things we can do to stay healthy, as a matter of fact, not even to fall ill. You watch, there is a level you get to. If you get to maybe 40 and above, you need to cut down the kind of things you eat. Dieting is very important. Some persons will even tell you, maybe for the past 1-2 weeks, they've not even done vegetable. Some persons have not taken fruit. Not even dates, not even watermelon. Not even, these are things that you can actually lay your hands on. We're not saying you should eat a basin full of it. That's not what we're saying. But just a little of it. From time to time, try to check your system. Try to speak out. If you're sick, speak out. Speak to people. Don't die in silence. Some persons will tell you, well, the economy is challenging, so who will I run to? Say it out. Speak out. But then, some of these things, not all, can be actually prevented. Lifestyle play a lot of role. Some persons do a lot of alcohol. Some persons feel it's an enjoyment. They are enjoying themselves. They want to flex. It is my birthday. I need to down some bottles. It is my friend's birthday. I need to down some red meat. These things have implications. All right? The more of this you take, the more sugar you accumulate in your body. And you know diabetes is rampant today. Some persons will not even discover it until they get to 40. But it's so amazing that some of the sicknesses that we say is common with elders, is common with people who are aged, is now found in people who are very, very, very young. I'm not talking about some sicknesses that are hereditary. Some are hereditary, but some are as a result of lifestyle. So your lifestyle matters a lot. Whatever you're doing, you need to know that first and foremost, you need to be alive to be successful. You need to be alive to enjoy life. That's it. Because taking too much alcohol excessively, some people are addicts, some people smoke, even though the person who is selling the cigarettes to you will tell you that smokers are liable to die young. You still go ahead to take this tobacco. For some persons, it's a lifestyle. Some persons are addicted to it and they can't leave it anymore. But these are some of the things that result to complications, that result to ill health, that make you sick, that make you do self-medication. I think on Global Morning today, what we're doing is trying to educate ourselves. We are speaking heart to heart. Research has shown that people who diet well, when we're talking about diet, now somebody will be talking about how I can't afford fried rice now. Where will I have money to buy shawarma and be eating shawarma every week? That's not what Ramsey is saying. That's not what Ramsey is saying. Balanced diet is not compulsory that you must eat meat full your plate. You need to see when some people are eating cow meat. You are taking as much as a plate full. Some people cannot eat without taking a bottle of orobo. That's it. A bottle of orobo. Soft drink. A bottle of it, the big size. They are consuming red meat. They are consuming a bottle of orobo. And for the past 1 week, what they've been eating is carbohydrates. If they are not eating yam today, they are eating swallow tomorrow, or they are eating rice next tomorrow. You see the cycle. But what mixture are you having with it? What kind of soup are you using with the swallow? The rice. What kind of stew? What kind of meat do you have in that stew? You know, these are little things. You can do these things, all right, within what you have, and you can stay healthy for as long as possible. I'm not taking out the place of check-up. There is need for routine check. Yes, very important. Routine checkup is not meant for big men alone. Some persons will say, hey, I'm not a big man. How will I be going to the hospital to check myself weekly, or maybe twice in 3 months or something? These are things you can do, and we thank churches, mosques, non-governmental organizations who do free checkup now. It's everywhere, free checkup. You can check yourself free of charge to know how healthy you are. What am I trying to say? Self-medication and its implication in a challenging economy is the topic of the day. And as a matter of fact, we've been able to do justice to it. My guest, who is a medical doctor, had an emergency just a few minutes into the program. Already we're trying to get connected to him via Zoom before that call came, and a life needs to be saved. As I'm talking to you, he is live in the theater trying to make someone live just the way you and I are living right now. And this is going to be the size of our conversation today. But then the bottom line is, checkup is very important. Self-medication has its implications. It's good to get tested before you go for any form of medication. Thank you very much for staying with us. Thank you very much for keeping a date with us on Global Television. Don't forget that this is weekend and we have so much lined up for your viewing pleasure today. So all you have to do is stay connected, stay on the dial, all right? Don't tune away, and make sure you keep viewing Global Television on DSTV, Star Times, and of course on all our social media platforms. My name is Ramsey Enoch, and I want to wish you a very wonderful weekend. As you go for your event, be watchful. Don't take anything that will be harmful to your health. Have a wonderful weekend ahead of you. Bye-bye for now.
Welcome to Global Morning.
Death toll from flooding.
Most time our politicians just bring in policies too, for sure. If you don't say we have several more stories.
The legislature was carefully crafted to